All right, so we're looking at endometriosis. All right, so endometriosis. So endometriosis, of course, from the word endometriosis, you can pick out the word what endometrium. So endometriosis is just issues around the endometrium. You can see all of them around the endometrium. So the thing is, from the endometrium, it can now spread, to the fallopian tube, can spread to the ovaries. So it's just a chronic, it's often a painful condition. Now this is where tissues that are similar to the lining of the uterus, that's like the endometrium, they are growing outside the uterus. Like, are you getting? Like tissues that is supposed to be here. Alright? You now find them outside in the fallopian tube, in the ovaries. You get? Alright, so you can find those tissues in the ovaries, you can find them in the fallopian tubes, alright, and also the pelvic lining. So the tissues behave like the normal endometrial tissues that you have. You understand? Just that they are endometrial tissues, but they are found in a wrong location. You must be in the right place at the right time. Alright, so but it has no way to exit the body. Alright, like the tissues go to other places, now they can't leave the body, so they can lead to what? Inflammation, scarring, sometimes cyst formation in different parts of the body. Alright, some common symptoms is what? Pelvic pain, especially during menstruation. So such a woman be having excessive pain, pain during or after sex, pain with bowel movement or urination, especially during periods, heavy or irregular periods. The woman is weak, her stomach is getting big, she's vomiting, then she's not able to conceive a child. So possible causes, exact cause is not fully known, but at least we can have a guess, towards what is possibly wrong. So sometimes it's retrograde menstruation. Retrograde menstruation is like, if you have menstruation, right, it should come down. So if you are menstruating and it's going backward, I don't know if you understand me, which is a reasonable stuff. Immune system dysfunction. So sometimes your body fails to eliminate what? Endometrial tissues that have died or something. Sometimes if your tissues or cells die, they have to be brought out of the body. So if your body is not able to do that, you have them spreading to other parts of the body. So genetics sometimes is just like some people's makeup just predispose them to having such a disease condition. Surgical scar implantation. Alright, so endometrial cells are attached to surgical incisions like C-sections. So diagnosis is pelvic examination, ultrasound or MRI, laparoscopy. Laparoscopy, like they open your stomach to see the uterus. So treatment is what? Since it has to do with inflammation of your body parts, you give drugs that will stop that inflammation, like what? Non-steroidal anti-inflammatory drugs. You can give drugs that can control the hormone and all of that. Then surgery. You do surgery just to remove the endometrial tissues. So in severe cases, you might just want to remove the whole uterus. Alright, now that's what they call hysterectomy. They cut everything out. Most of the times is if the benefits outweighs the benefits of the surgery outweighs you trying to deliver again. So that's just it for what endometriosis simply means. You are having endometrium tissues outside the endometrium area. Right tissues, but they are at wrong locations.